Imagine you're on a vacation in a totally different country. Think of Jakarta, the capital of Indonesia. In this amazing country with such beautiful cultures, all the beaches, mosques, cathedrals, and clubs. You're walking to the taxi, but then what if you are in the public hospital of RSCM, Rumah Sakit Cipto Mangunkusumo Emergency Room? As RSCM is a public hospital as well as a referral hospital for complicated cases, it is part of the primary, secondary, and tertiary healthcare, which means in the hospital, you'll get more specialized help when you're dealing with comorbidities and severe cases. This hospital has almost all advanced diagnostic and therapeutic medical technologies. As Jakarta is a big city, the public hospital have great resources. Unlike many healthcare in rural areas, which is still in great need of staff, equipment, payment, and specialization, 65.6% of the primary healthcare facilities were without working incubators. Only 6.2% in the rural area had complete polyclinic equipment. There are many degrees when it comes to public healthcare. Usually, people from the city who attend the public hospital will go to the puskesmas first, which is the primary healthcare. But people from the slums or in rural area will attend the moving clinic, where medicine and equipment are very scarce.
Why do you go to the moving clinic instead of the puskesmas?
Because he thinks that this place is more accessible than Christmas because he has to work. I think the main consideration is about the time. But she goes to the first Christmas if she has like more severe complaint.
We also got to speak to someone who went to the public hospital RSCM.
Could you maybe introduce yourself?
Saya Ibu Nana, bekerja di Mata Endokrin, menjadi honor.
Is there a reason you went to the public hospital and not the private?
Kalau umum ada BPJS ya, ini BPJS. Kalau umum ya terus sendiri kan mahal karena laboratoriumnya berapa, terus biaya pendapatannya berapa. Jadi karena BPJS nggak bayar, jadi saya bikin BPJS.
In 2014, a healthcare program called BPJS Kesehatan was launched. It was expected to cover the basic healthcare services, and it has significantly aided the growth of hospitals and clinics. This growth was due to the insurance enabling more people to visit the hospital. However, the coverage is still not maximized, as only 62.3% of the Indonesian population is covered.
Do you have another healthcare insurance besides the BPJS?
Nggak ada.
How many times do you go to a hospital in a year?
Nggak pernah sekarang udah nggak pernah berobat.
How was your first time visiting the hospital?
Tahun berapa ya? 2020 deh kayaknya. Karena berdebar-debar, terus pernah ke IGD, panas keringetan tangannya. Iya malam habis pulang kerja, terus saya minum vitamin hemapiton. Kayaknya nggak cocok kali hemapiton ya, begitu. Kemudian 1 jam tuh, ini dada sakit gitu, dada sakit banget. Iya, jadi di sini aja gitu nih, kayak kayak sakit banget gitu. Kayaknya gimana gitu sama suami, langsung bawa ke rumah sakit yang terdekat. Kalau beginian mah harus ke rumah sakit yang terbesar gitu. Ya udah, jadi dari Wujong naik taksi ke IGD. Ya udah, beliau dikonsultan ke endokrin karena ada.
How did you feel during the hospital visit?
Nyaman. Tapi udah biasa di RSCM, Nggak ada. Alhamdulillah.
Overall, the level of satisfaction of patients who visited private hospital was higher than the ones at public hospitals. People were significantly more satisfied with service time, fees, competency, and handling complaints. So the service in public and private healthcare differ quite a bit. The public hospitals are crowded with long waiting hours, and sometimes it's even hard to make an appointment. When recovering after, for example, surgeries, you are most likely to share a room with 5 or more other patients. Even the level of satisfaction between public hospitals can vary a lot.
Were you satisfied about your visit?
Aman-aman, nggak ada apa-apa.
What did you think of the process? For example, the referring.
Cepat ditangani, soalnya masalahnya udah kenal semua, jadi udah kenal, oh iya itu Bu Nana, udah. Terus udah itu ya nggak apa-apa, udah bagus, pulang.
When talking to a doctor, do you feel free to say and ask anything you want to?
Nggak takut sih gitu, orang ya namanya ini ya nggak ada takut lah, biarin namanya gitu. Karena kita kan ya di rumah sakit, ada apa gitu.
How long did you already have the symptoms before going to a hospital?
Actually felt the symptoms from 10 years ago, but the symptoms getting worse 2 years before the diagnosis.
Why did you not go earlier to a hospital?
Dulu sih emang lagi karena batin kali ya, dulu kan suami itu kan ya, ya namanya laki-laki gitu kan, ya makanya sekali pikiran atau apa gitu, jadi badan tambah kurus sampai 54, dari 75 sampai 54 drop.
Usually at RSCM, you'll see more severe cases, which can be due to patients waiting too long before going to the hospital. Indonesian people consider themselves healthy when they can still perform day-to-day tasks. In addition, many illnesses like HIV still faces a lot of stigma. This causes patients to waiver a visit to the hospital. In Jakarta, you also have many specialized public hospitals for specific diseases, like Sitanala Hospital, which specializes in leprosy. So depending on your condition, you can be sent to many different hospitals or clinics within the public health sector. Alright, now we know enough about public hospitals. What if you're in the private wing of the hospital RSCM Kencana, Rumah Sakit Cipto Mangunkusumo Kencana? As mentioned before, there are many degrees of healthcare. However, in an emergency, you are treated the same way. After the critical period, you are free to choose a hospital you want to be treated in. You can decide to go back to the private wing of the RSCM hospital.
Do you always go to the private hospital?
I rarely go to the public hospital just because of the queue actually, and it just took very long just to see the doctor if we went to the public hospital. So that's why I usually went to the private hospital.
As reported by the Directorate General of Health Services from the Ministry of Health, Indonesia currently has a total of 2,813 hospitals. 1,787 of them are privately managed. The private hospitals are often less crowded compared to the public hospitals. The number of patients attending the private hospital is often 20% of the public hospital.
What do you think is the biggest difference between a private and a public hospital?
Vivek, the hospitality treatment for the patients actually. In the private hospital, they usually really get into the patient's needs. So I think it's just the hospitality and the queue for the doctors and the treatment and the medication. Maybe the difference is just in public hospital they usually use the generic medication, and for a private hospital they don't usually use generic products.
Do you feel like the doctor took the time to know you?
No, actually, but it's uncommon here just for the doctors to know a lot about us. They actually just want to know our symptoms and just give us the overview of the disease and then give the medication.
All patients who go to the private hospital have insurance to cover the cost from the private hospital. In private hospital, they sometimes use medication or treatment which are not covered by the BPJS. The insurance is also needed to cover the higher service cost per bed of the private hospital.
Do you have another insurance besides the BPJS?
Yes, I do have a private insurance.
How much do you pay for the private insurance?
Oh yes, I paid for the private insurance for like 1.5 million per month.
With the private insurance, what is the cost per visit?
Because I'm actually a medical doctor, so they don't charge me for the doctor service. So I got a lot of discount from there, maybe 600 until 1 million. So they charge me for the medications and the administration, just that.
Of your hospital visit, about what were you the most satisfied?
Maybe the hospitality in there, just everyone's being nice to me, and then the doctors really answers all my questions, and they did give the medication that works really well for me, so it's all satisfactory.
Were you free to say or ask anything you wanted?
Yeah, other than being a medical student, we're actually just a person, and we have this stupid question that I actually want to ask them, but I'm ashamed if I ask them because it's so stupid. Yeah, I just asked Google.
If you were the head of the private hospital, would you change anything?
No, I don't think so because it's very nice in a private hospital actually, because they are patient centered. So they did everything they could for the patient's comfort.
What if somehow everything in Indonesia changes and there will be no public or private hospital anymore? Everything will become one hospital. What would you think of that?
I think it would be chaotic because it's not the system here for a long time. The private and public hospital always been the system here, and it would be chaotic if they just change it all at once.
Now we have an overview of the private and public hospitals. To illustrate a more accurate picture of the opinion on the healthcare system, we conducted a questionnaire. The questionnaire showed that 92% of the people in Indonesia go to public hospitals. Most patients are satisfied with the current healthcare system. 14% were not content with the healthcare system. Furthermore, most of the patients gave the hospital they visited a 7 or an 8. As you can remember, we came by ambulance, but Indonesian citizens prefer other transportation modes. Ambulances in Indonesia are more often used to transport patients from one hospital to another. And in an emergency, most people prefer ride-sharing service cars, like a taxi. Reasons for this is the availability of service, cost, and ambulance response time is too long. They were not aware of the existence of ambulance services. More than 75% did not even know how to contact the ambulance. Patients that did arrive by ambulance had a median time of 2 hours until treatment. This time can be explained by inadequate infrastructure and heavy traffic. This is a problem regardless of the private and public hospital. There are doctors who are working in both hospitals for several reasons. Let's ask a specialist who works in the public and private hospital for more information about the difference between those hospitals.
Hi, my name is Diki. I'm an endocrinologist. I'm currently working as a lecturer in the Faculty of Medicine, University of Indonesia, as well as working as a clinician at the Dr. Cipto Mangunkusumo Hospital, Jakarta.
In which hospital did you start working? In a public or private hospital?
I start my working as a doctor. I work at the public hospital because when I graduated from medical school, I directly then continue as an internal medicine specialist, and then I directly work at the public hospital at the Dr. Cipto Mangunkusumo Hospital. It is a tertiary referral hospital, a national referral hospital. I'm very lucky to be able to work in this hospital. And then after finishing my endocrinology fellowship, also PhD, and then I also do my private clinical practice outside the hospital.
To obtain a master's degree of medicine in Indonesia, medical graduate must undertake 3.5 years of undergraduate training at a faculty, followed by 2 years of clinical rotation at a national board examination. Since 2011, medical graduate, also called general practitioners, have to undergo an additional 1-year medical internship at a public hospital. After that, the general practitioner must complete a residency program to become a specialist. Specialist training is done in a number of designated academic hospitals, all of which are public hospitals.
Could you tell us about your time schedule?
Well, the time schedule is really a bit packed because during the day, we need to, because as a government employee, we need to work like 8 hours a day in the hospital, also as a faculty from Monday to Friday. And in those 8 hours, usually we need to combine between teaching, between clinical care, combining in the outpatient clinic as well as in the inpatient ward. But as well as in between, we also need to do the research as well. So we need to do 3 kind of tasks, combining those 3. Usually in the evening, most doctors, including me in Indonesia, we also do private clinical practice as well. Some of us do every day, every evening. I do maybe 3 times a week in the evening to do my private practice as well.
Indonesia's health regulation allows health personnel to work in both public and private sectors. This aims to motivate the physicians to work in both sectors. Approximately 80% of the public physicians in Indonesia also work in the private sector.
Why did you decide to work in both hospitals?
Well, it's actually depends on several things. The first one is actually in the public hospital. Usually you treat patient mostly the one that use the universal coverage healthcare system using the BPJS, mostly from the on those people who don't really have the private insurance and so on. So they have limited access actually to the more advanced diabetes care as well. Well, if you're working on the private practice, you have the chance to give the patients access actually to almost all kind of treatment that is recommended by the guideline, right? That's why it's easier for me to treat patients according to the guideline because we have all the options available. And so also you would see different type of patients comparing those in the public also there. And then the other thing is maybe it's a bit sensitive. We don't have really a big guarantee income from the government. That's why usually most people who work at the public hospital also work at the private hospital as well, usually in the outside of their working hours in the public hospital.
Specialists in Indonesia receive between 65% and 80% of the payment from private hospitals or private clinics. A study suggested that 65.6% of the income for surgeon and 81.2% of obstetrician work from private sector, while most of the physician's salary comes from working in private hospital. Only 25% of the population can afford private healthcare.
What is the biggest difference you have noticed between the public and the private hospital?
Well, I think the biggest difference would be, well, in terms of care, it's not really much difference, but of course the access of different treatment, that's the huge difference. Because in the public hospital, because they are using the BPJS insurance, most of the newest drugs, for example, the SGLT2, GLP-1, they are not covered by the BPJS insurance because they are so expensive. While in the private insurance, and private clinic, usually people, because they came from the middle and up financial group, then they can afford to the newest drug, for example. And I think that the next difference would be the level of education, but it's not always the case. But usually in those people in the private clinic, usually they are more open to discussion. So usually before we decide on giving some treatment, we need to discuss about the choices, and then we can discuss with them what would be their preference.
If you were the head of the public hospital, would there be something you'd like to change?
Well, I think one for sure is I think the bureaucracy is too long, because if a patient wants to go to the hospital, they need to go, for example, to the primary care and then refer to the secondary, tertiary, and so on. But maybe for those in the complex cases, they should be able to send directly from primary to the tertiary care.
Every Indonesian citizen can go directly to a puskesmas. If they need further treatment in a hospital or specialist clinic, they will need a referral letter. Without a referral letter, they cannot go directly to a hospital or specialist clinic, except in an emergency. In the private sector, the patients can just go to the private hospital or specialist clinic without a referral letter.
And the second one would be the medications. For now, for example, at the public hospital, we can only give the medication for 1 month. Despite patient having a stable, well-controlled diabetes, for example. So I would be happy if they can come every 3 or 6 months only, so I can reduce the burden for the doctors, right? So they don't need to see 100 patients a day, for example. So they can concentrate to the most difficult cases, not well-controlled diabetes, so they can improve the quality of treatment. I think the most important would be that one.
The doctors in Indonesia must treat many patients in one day. Research revealed that 83% of the physicians experience moderate and severe burnout symptoms. The rest experience lighter symptoms.
Can you describe what your typical day looks like when working in the hospitals?
Well, the typical day would be on Tuesday and Thursday. So usually in the morning, first in the morning, we usually did the discussion with the internal medicine in training, residents in training, also endocrinology in training, usually early in the morning between 7 and 9. And then we do clinical care from 9 to 11 or sometimes to 12. And then, of course, lunch break if possible, and then continue with the discussion. Could be discussion with the students, but also could be also research discussion as well. So then I usually go home with my kids, and then in the evening started the private clinic. So it depends on the number of patients, but I usually finish my outpatient clinic at the private hospital around 8 to 9 p.m.
Could you list the pros and cons of the public hospital and also of the private hospital, please?
Well, I think the public hospital, the pro is quite affordable for most people. The thing is only about the access to care in terms of the newest drug. They don't have access to that one. And in terms of the private hospital, I think as long as the doctor they must be ethical to select only the best treatment, not really doing the unnecessary things.
The government ensures the rational use of medicines and regulates the drug price for several essential drugs. The availability of medicine in public sector is far from optimal compared to the private sector. This could be due to a restriction list being used in public sector and not corresponding well with the list of medicines surveyed.
And our last question. We hope not, of course, but if you were to fall ill, would you go to a public or a private hospital?
Well, it depends. I must say if I get sick, I will go to this hospital because this hospital has the best medical specialty, of course. And then, for convenience, it depends on the level of the sickness. If you are maybe on the mild and so on, maybe it's easier to go to the private hospital because you have less hassle in terms of bureaucracy. You just show your private insurance, get treated, and then go home. But if a more more advanced cases will need longer treatment, much more expensive treatment, then we need to opt for the BPJS because they have well covered for critical illness and so on. It's much better. Or in some cases, you can even combine with those insurance actually.
Conclusion: both hospitals have their pros and cons. Public hospital might have long queues, but are more affordable for most of the people. In addition, there are a lot of specialized public hospitals for referrals. Private hospitals are expensive, but more comfortable. Besides this, they have many access to the newest treatment. These might be the best, but not always necessary. Where would you go? Public or private hospital?
Be happy and be a good doctors there.
I would be happy to have more conversation or more collaboration with Prof. Nowen from the Netherlands, from Erasmus as well, because we can enrich our students with other aspects